medical professional, I still remember the day as young graduates when we ran to do our first ward rounds, and we went to the maternity ward, picked up the files, and we read through the files, and there's everything, pages and pages given on how the child is doing, okay? The child is feeding, vaccinated, sleeping, urine, stool, everything is accounted for. And the line on the mother, on how the mother is doing now, is just a single line: stable postpartum status. And that struck me as very odd at that time. And in fact, this disparity became all the more evident when I had my own child. And I realized for the first time that the mother runs the marathon, and suddenly, the minute the child comes into the picture, the mother is in the background, you know. So today's conversation isn't really about pregnancy and deliveries. It is mainly about bringing out this powerful shift on how we look at mothers, motherhood, and the motherhood journey from the physical, from the mental, emotional, and the cultural aspect of it. I have some wonderful chairs with me today. Thank you so much for being here. And my first question is going to be to Dr. Janhavi. Beautiful work with Aastrika Midwifery Center, the Aastrika Foundation. As a mom, as a philanthropist, I'm very curious to know, Dr. Janhavi, how do you see this entire birthing evolution from both the perspectives, the perspective of a mother yourself and in the journey of Aastrika too?
I don't know if I would yet call it an evolution more than an evolution those of us who work in this space are trying to, achieve. I think as of now in India, it's still the experience you talked of. It's very normalized for the baby to be the focus, or 100 other criteria, but not necessarily the mother's experience of birth or early motherhood. I mean, what you said, somebody I follow closely, Emily Oster, she says that, in pregnancy, the mother is the be-all and end-all, and once the baby is born, she becomes like a lactation accessory. And I think it's more true in Indian families that the attention really shifts to the newborn and the grandchild. So increasingly, I think there is some degree of awareness of, or things are changing very slowly. I guess I would put it like that. But at least in metropolitan India, there is an increasing awareness of the kind of quality of maternity care available internationally and where there are lacunae in India and what is potentially achievable. So our work at Aastrika Midwifery Center, which is a boutique birth center in Bangalore, which we run, definitely does target, it is a private sector hospital, and it does target those who are perhaps more discerning in what they are seeking from their birth experience or motherhood journey. And as you mentioned, Aastrika Foundation, yes, we do a lot of work in non-governmental hospitals on improving both on, maternal and infant mortality rate reduction, but also on ensuring that mothers and families have a more positive birthing experience. Even in government hospitals, it is critical to ensure that families, have a good experience. And I think, as you would have remembered perhaps from the time on the wards, there's a big culture of disrespect and abuse in labor rooms in India. So we work a lot on that.
Fantastic. Nobody really talks about that bit. I'll be very, very honest, because I work in that field too. And coming to you, Dr. Mahima, because a large chunk of mothers, just a couple of days back, I remember a mother coming to me and saying, Doc, I need your help. My child is 2 years old. I can't understand why I'm so angry all the time. My family has started fearing talking to me. And nobody really understands that this is also part of that motherhood journey, which probably began even during her birthing process. So my question to you, Dr. Mahima, is how much of a role does that psychological and emotional safety play for a mother to experience her motherhood?
So thank you for the question, Dr. Bhavana. It is an essential part of the beginning of motherhood, the emotional well-being of the mother, the mental health of the mother. If we talk about the postpartum well-being, we do see a lot of people spreading awareness on postpartum depression, but not too many people talk about what mothers go through during the pregnancy or birth trauma, PTSD, and how that leads to higher chances of triggering postpartum issues related to mental health in a mother. Most of the pregnancies nowadays we see are either women in their late 30s, or even nowadays we see a lot of women conceiving through IVF in 40s. And the entire pregnancy, they have a lot of fear of probably preterm delivery or miscarriages or loss of pregnancy, and because of which we also see that these women in pregnancy itself or even before the pregnancy are going through a lot of mental health issues, which can get triggered because of hormonal imbalances post-delivery, and they will take a while for them to adjust their new life according to the baby's requirements, especially at that particular advanced maternal age. So it definitely plays a huge role in especially the early parenthood phase, and it's important for family members, for doctors, therapists, friends, even workplace to understand that what mothers go through during the postpartum journey. And when a woman who's been working majority of her life till her late 30s and 40s gets to take a maternity break, somewhere back in her head she misses going to office, she misses having that empowerment at workplace.
Identity, yeah.
Yes, and it takes a while for her to realize that now her life has changed, there is a new responsibility in her life, and they will take time to adjust to it. Unfortunately, the expectation from a mother in today's time has become too much in today's society, yes. So that becomes very challenging for them. So I think somewhere we need to understand that mothers, they all are different. Every mother is different. Every baby is different. So not every mother is going to adjust to the baby's demands within one day. Some mothers will need extra time. They will need extra coaching and support from the family members. Maybe some mothers are not going to be good at it. That doesn't mean we judge them as a mother. It's just about how we help them adjust to the new requirement in their life.
Very, very well said. That part about, every person around, every stakeholder around the mother also has a role to play. I think India initially had that whole cultural approach to managing and supporting women who were pregnant. We had a community around her. Suddenly now, of course, care started getting externalized to hospitals. It became a little more lonely out there, where it's the doctor and the nurses taking care of the baby. And what was wonderful about Aastrika, I think, was when I read, was how the entire focus is also on getting the midwife and the doulas and their role in the experience that a mother has. So how has that now changed the narrative? Just because now they are also part of the entire ecosystem.
Right. So midwives, India has introduced a cadre of professional midwives, so akin to what you might find in the US or Europe or so forth. So it's in the allopathic system. They are BSc nurses or GNMs who have finished 1.5 to 2 years of master's degree specialization only in midwifery. So they are healthcare providers. They are the primary healthcare provider for the mother during labor. But they are also, I think they're trained far more than obstetricians to provide emotional support and to provide mother-centric and women-centric care, which is very much the core of a midwifery approach. So because midwives are centered around the mother's emotional well-being and not just her physical safety, and in fact her physical health, not only that she should be healthy and survive, but also how healthily and how does she feel, not just emotionally, but also physically, right? So something very simple like how mainstream obstetrics does routine episiotomies for all mothers, which is not evidence-based. A midwife won't do that, and that will leave that many more women walking away without any stitches, without any recovery, healing needed. So there is a lot more focus on the mother's well-being and outcomes in a midwifery approach. Doulas are a little different. Doulas are hired directly by families to provide emotional and informational support. And certainly for those who can afford it, it can be a great additional support system. So these things are just slowly picking up in India, but women who have, in India we don't necessarily place much value on emotional support, that it's something which can be expensive, but slowly that's changing and people are putting the value on their own emotional well-being.
No, since you say that, I think in certain ways it has always existed. I know of people who prefer a certain hospital. I mean, I'm not going to take names, but they prefer a certain hospital when it comes to deliveries, not because they have the best doctors. It's because they have the best nursing care for a mother out there. So the role of midwives, nurses, doulas, they've always been existing. It's just that somebody has to now get up and say that they can actually take the front role rather than the back seat to clinicians. So I completely align with that bit. Dr. Mahima, I've also read about your work related with a lot of IVF pregnancies. Now, how do you view the emotional and mental health support for IVF pregnancies being different than normal pregnancies?
So if we look at the success rate of IVF, couples need to understand that yes, nowadays there are a lot of fertility issues. In fact, on an average, we see about 50% of fertility issues occurring in men. So it's not only the women who have fertility issues. Unfortunately, if we look at tier 2, tier 3 cities, the in-laws take it for granted that if there's a fertility issue, it is going to be the woman. And they fail to even accept that the male partner even needs to go for a screening. So a lot of women go through a lot of anxiety issues at that time because they feel that, why my husband cannot come with me for a screening process, or why only my body has to undergo the hormonal injections and therapies. And IVF pregnancies, there's no 100% guarantee that the first attempt of IVF is going to give you a pregnancy for sure. So there could be a failed IVF in the first cycle or a second cycle, and mentally it's quite exhausting for a woman to undergo the repeated process until the pregnancy comes positive. And even then, there are chances of, early miscarriages in IVF pregnancies. So not too many people pay attention to how important mental health is for couples who are going through IVF. It's not just about getting pregnant, it is about how to have a baby, because once you're pregnant, there are chances that you can have complications in pregnancy, you can have a loss of pregnancy, going through IVF again and again. Then comes the question of having a premature baby, and then the long stay of baby in the NICU, which leads to more of anxiety in the couples. The recent case of a mother who had a baby through IVF, and she lost her life in Pune at a recent charitable hospital. It's in news everywhere all over India. So again comes the question of affordability of backup facility, or if there's any high-risk surgery during the time of birth, NICU care for the baby. So sometimes, okay, under pressure that, there's a society pressure, you need to have a baby, they will go for IVF. But what about the affordability to ensure you're able to give the best medical support to the mother throughout the pregnancy, the mother at the time of delivery, the baby at the time of delivery? Unfortunately, a lot of couples go for IVF, but they're not able to afford all that. So I think we need to pay more attention to these factors of IVF pregnancies, and that's where I try to promote awareness and help couples during that time.
Yeah, and since you mentioned that, I think also the aspect of multiple pregnancy, for example, twins, triplets, the chances become much higher with IVF, and nobody prepares you for that. So I have had couples come to me and say, I had a kid, and my second kid, I tried with IVF, I wasn't expecting twins. And now you have 3 kids to manage, and you are clueless on not just physically how to do this, even the financial affordability. Let's be honest about it, So yeah, those aspects do not get covered when we talk to parents about IVF. Before we really come to an end or wrap up of the session, Dr. Janhavi, I would like to take your personal opinion on what is that one thing, if you could shift right now, about the existing maternal health aspect. What would it be?
I think for me, I really feel that educated, elite, empowered women need to stand up for themselves. Maternity care in India is atrocious because women accept it. It's really, right? Yeah. It is, okay, atrocious may be strong, but India faces what we call the too much too soon or too little too late phenomena, where either you have impoverished settings where you have inadequate care, or the moment you have access to healthcare, you have 80-90% C-section rates. Right, high rates of episiotomy. The C-section rates in metropolitan hospitals are around 80%. And that leads to a fair amount of morbidity and recovery for the mother, but women are not saying, no, I won't tolerate it, right? There is very, very little, willingness from women to insist to their own family that my healthcare, the quality of outcomes for me, is an important factor. That so many families will not take it into consideration. Either it's, no, it's inconvenient, no, it's too expensive, why are you not satisfied with this local neighborhood hospital? Now, if women are unwilling to go seek out good care, without that demand side pressure, the hospital system is not forced to improve at all, because people are coming anyway. And if those who are privileged will not fight for themselves, it becomes very hard in all the government hospitals and all to try and improve the quality of care for low-income women, because the quality is so mediocre even for the wealthy. So something I really that is my thing, that I do think that women who are reasonably empowered should really take a stand when it comes to their own healthcare, which right now I don't see. Even at Aastrika, we have so many situations where the pregnant mother wants to come, but she is unable to convince either her husband, her in-laws, or her parents. But she's also, despite being well-educated, earning, being like 30, 35, whatever, unwilling to stand up for herself, which bothers me.
No, this is a very apt point, because even from your own personal experiences and experiences of the deliveries that happen around, you will realize that the minute a woman is pregnant, I don't know whether it is the fear of things or, just the lack of experience, what takes her to just hand over the decision making to other people. She refuses to start taking decisions. Even if she can read all the books under the sun and talk to all the experts, she will not be the decision-making person. So I completely agree with that point of yours. Dr. Mahima, what is the one message that you would want to leave for every mother-to-be or a mother currently?
So I think self-love is something that, I would love to advise all the expecting moms or the new moms that, yes, of course, you need to love your baby, you need to love your child, but don't forget yourself. Don't forget to love yourself, because you have to keep a balance of both. You have to love your baby and at the same time your own body, your own mind, your own identity. Don't stop doing things that you used to love doing before having a baby. Take out time for yourself after having a baby, and when you are happy, you will pass on that happy hormones to your baby. So your mental health is equally important for you to keep your baby happy. So don't forget to love yourself.
Oh, how lovely. I think just in one of the previous sessions, somebody said, right, that my wellness is a we, it is not just me. So a happy mother will definitely ensure that she brings up a happy child, a happy family, and a happy household and community. So, keeping in tab with the time, I would like to say that motherhood does not really start and end in delivery rooms. These are conversations which have to go beyond the hospitals, beyond the clinics. They have to be in homes, they have to be in communities, they have to be at the policy level too. And, as pointed out by Dr. Janhavi, I think mothers have to take the onus for bringing these conversations. Or women who want motherhood have to be talking about it as fiercely as they talk about anything else today. So I hope that we carry this conversation beyond these rooms, and thank you, BW, for this wonderful topic and a wonderful podium out here with the two of you. Thank you so much.
Thank you, everybody.
Thank you very much.